Let's ask my old friend, former White House COVID emergency response coordinator, the dean of Brown University School of Public Health, Dr. Ashish Jha. It is good to see you, Dr. Jha. It's been a minute.
It has been a minute, Chris. Great to see you. Thanks for having me here.
So, Doc, give me your take on where we are with this 2-in-1, and then I want to have a dialogue that will likely exist with a certain percentage of our population. But what's your take on this? Yes or no, good or bad?
I'm optimistic. Look, preliminary data, I always like to look at the full set of data. Those data are not fully out yet. We're gonna look at everything, make a decision. I'm not, the FDA is. But I've been pushing for this. I like this idea. Single shot makes it easy. You go in, you get one shot, you're done. Again, if the data pan out, I think this is going to be really convenient for a lot of folks.
All right, now here's the concerns. I'm not putting more mRNA in me. You guys lied to me the first time about it. I don't know how much spike protein it's going to make in me. Everybody's getting vaccine injured, and now you want me to do it again? This is only good for Moderna, not for me.
I hear that. I'll tell you, I'll start off by talking about what I advise my own family. I have elderly parents. They get COVID shots at least once a year. I get COVID shots once a year. It's what my family does. I just think from a safety and health point of view, to me, this is a no-brainer. mRNA, people get very kind of bent out of shape over it. Look, mRNA is in every single cell of your body. All your cells have DNA. DNA makes RNA. mRNA is one of the types. This is not some unusual substance. Literally every cell in your body has mRNA. And you know, how many people have gotten COVID vaccines in America? 300 million, like, you know, or 250, between 250 and 300 million people. Most people have done very well with it. Most people have had very little in the way of reaction. So yeah, I get the concern, but my view on this is these vaccines are incredibly safe. They work really well. And that's why I continue encouraging my family to get it.
Not from Ashish Jha, but the messaging was mixed and muddled early on. This isn't really a vaccine, the mRNA stuff. It doesn't immunize you. It doesn't really stop transmission, except early on, and then the thing mutates too fast and the boosters can't keep up. And I'm not sure that I can trust the messaging this time either. How do you regain trust with a population that believes they were sold a bill of goods that was incomplete at a minimum?
Yeah, look, I think the way you restore trust with people is you just be honest and straightforward with them. I've tried throughout the whole pandemic to be honest and straightforward. We haven't gotten everything right, but that's fine. That's normal in a pandemic. You're learning as you go along. And yeah, the virus mutated, and that caused some of the initial benefits of the vaccines to wear down. But here's what we know, Chris. We still know people are getting sick and dying of this virus. Not that many, and certainly not compared to what we used to see. Almost all those people are elderly who have not kept up with their vaccine. So for me, the evidence on this is very clear, and the communication's got to be very straightforward. What do we know? What do we not know? That's why on this double shot, I didn't come out and say, hey, this is awesome. I said, look, let's look at the full set of data. If the data bear out, we'll do it. If the data don't bear out, we're not going to go forward with this.
Well, do you think it should be something where you don't mess with kids and you don't mess with the young and strong, just make it to the old and the vulnerable? And should that have been the rule during the pandemic? Should it have been no mandates for the young and healthy or the kids? They don't need it. No mandates except for the older. They can get it if they need it.
Yeah, so here's what we knew. Obviously for older Americans, immunocompromised people, it was life-saving. What we also know, we saw this in the Delta wave, we saw this with Omicron as well, but certainly in the Delta wave, a lot of young people did still get pretty sick. So I always think back to what did I think was good for my family? Every one of my kids has gotten vaccinated. Obviously my elderly parents, my wife. I think everybody's a bit better off. The kids are probably better off a little. The elderly are better off a lot. Mandates is a whole different issue. I get why people are frustrated with mandates. That was a long time ago. Certainly don't think we need mandates anymore moving forward. But I think it's really important, especially for older Americans, to keep up on their vaccines, and this is a great way to do it.
Ashish Jha, you've always been a straight shooter with me. I appreciate you. I rely on you, and we'll speak again.
Sounds great, Chris. Thanks for having me here.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, And you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.